Good morning, YouTubers. This is Dr. Danny McClure. I'm a doctor of osteopathic medicine, just sharing my experience now that I'm day 22 after my Mobi-C disc replacement between C5 and C6. Things are going really well. I saw my surgeon in follow-up yesterday, and I just wanted to give an update. First of all, for me, my range of motion is really well. I mean, I really can turn so much further than I did before. Looking up, looking down, and I'm able to do all that without symptoms. My symptoms had a lot of numbness and tingling in my fingers, pain in both arms, the base of my neck, down my shoulders, and I've done really well since the surgery. I think my last video about a week ago, I still had some Dermabond tape over the incision site. I'll try to get this and show you. Maybe, hopefully you can see that, what things are looking like. I've got a little bit of antibiotic ointment on there just to keep it a little moist and hopefully promote healing and minimize scarring. But in seeing my physician in follow-up, now your physician may give you other recommendations, so adhere to your physician's recommendations, but my physician said I could start back working out. I had just been walking, so I got up this morning for the first time and broke a good sweat, so that's good. Did some I guess medium weights for about 20 minutes for me, and then did an elliptical machine. I thought would be nice since it's not since it's a low impact type of cardiovascular exercise. Did that for about 20 minutes, and that's a good enough starting point for me at my age of 50 years. So happy to be doing that. He said I could even ride jet skis if I wanted to, just don't do anything crazy. He would not allow me to do any kind of overhead motions of lifting like military press or even like lat pull down. So that's got to remain for another day. But other than that, able to kind of do what I want. I'm driving. I've been back to work for a couple of weeks now, and all that's going really well. So really couldn't be more happy with the procedure that I had. If anything, I regret putting it off for as long as I did, but really in hindsight, based on my nature, I'm glad I put it off the way I did. And all's going well. This is just my experience, but hopefully you guys are watching this. Either you're going through some recovery or you're anticipating possible surgical procedure. My advice is really strongly consider the replacement disc instead of removing the disc and fusing two vertebrae together. There are advantages to that. There's some unique disadvantages, like all things in healthcare. With the replacement disc, there as well are unique advantages and disadvantages. The advantages for me is that I've got disease in other discs in my neck, and the replacement disc allows good range of motion and it puts less stress on those other discs. So for me, 22 days into it, I think that's the right decision. We'll see what time tells, but wish you the best in your care and your decisions, and I'll probably stop giving weekly updates now and probably go to, I don't know, once a month or something like that. But I wish you all the best.